I'm Michael Bybee. The University of Texas Mitochondrial Center of Excellence at Children's Memorial Hermann Hospital is dedicated to treating all aspects of neurometabolic and mitochondrial disorders. Joining us today is our director, Dr. Kay Koenig. Dr. Koenig, great to see you. Thanks for being here.
Thanks for having me.
So I'd like to start off by simply asking, what are mitochondria?
Well, mitochondria, they're actually part of every cell, and they're inside the cell, and their function is to take the food that you eat and turn it into a chemical energy that your body can use to do all sorts of things, like make your muscles contract, make your liver work, make your brain function, things like that.
So what happens when mitochondria don't perform as they are supposed to?
So some people have a genetic defect that prevents their mitochondria from functioning properly. You can think of it kind of like a brownout. It's not a full-on blackout, but they don't produce enough energy to function. On a day-to-day basis, they can usually get by, but it's times when their bodies are stressed that they don't have enough reserves of energy to function.
So could this result into a disease of some sort?
It does. The diseases vary from being actually relatively mild to very severe. Some of our patients live healthy, normal lives, requiring medical intervention, but are able to live long lives and have their own families. Some of our patients, unfortunately, are more severely affected and actually pass away in early childhood. We see symptoms ranging from heart failure to seizures to mental intellect problems, to problems with their vision or hearing.
Mm-hmm. Now, does this affect a certain age group, race, sex?
It actually affects anyone and everyone. The disorder was first really recognized in the 60s and 70s, and so it's considered an emerging disorder. It's something that has been around. People just don't really know what it is, and we're just now starting to classify what it is and find better treatment options. So it affects everybody, from a baby all the way up to an adult, people of every race and every sex.
What are some of the treatment programs available for somebody affected by this?
Well, one of the most important things is recognizing the disease and recognizing that whatever's going on with the patient, there's a common functional problem. And these patients, if they're in heart failure, their heart failure is resulting from a problem with the cell being unable to produce enough energy. So really, when you're trying to target treatment options for that patient, you want to target your treatment to the cellular level and try to fix the defect where it started.
Is there a cure?
There is not a cure.
Really? Is that something, given your medical background, that you could guesstimate whether or not someday there will be?
I think there will be. The more we learn about the disease, the better able we are to target treatments. There's a clinical trial that is going on based out of Stanford right now that's looking at a medication to help improve function. We're doing a lot of studies at our center looking at the different types of complications these patients have and trying to really target treatments for their specific disease.
Let's talk a little bit about that. How is UT Mitochondrial Center of Excellence involved?
Well, we have a large center. We're one of 10 in the country, and we have a full-time social worker, a full-time nurse. We also work with physicians from multiple other specialties, and what we try to do is coordinate the patient's care while they're both in and out of the hospital. One of the common denominators of many of our patients, unfortunately, is that they see multiple specialists.
Right.
And what we want to do is make sure that each of those specialists is talking to each other and is working together to provide the best care for the patient.
So what would you recommend to someone who may have somebody that's personally affected and or thinks that they may be affected? What would be the steps that you recommend they take?
Yeah, if you think that you may know someone who has this disorder, probably the best step is to go and talk with your primary care physician first. Talk with them about the symptoms and ask them if they think this is a possibility. There's also a lot of information out on the internet, in particular our website. You're welcome to go there and take a look. And if you think you might have this disorder, you're welcome to give us a call. You could speak with the nurse on the phone or someone from our staff, and we'll determine whether or not we think that you need a referral.
Dr. Koenig, great talking with you. Thanks for being here.
Thank you so much.
Absolutely. For more information, visit utmito.org. For Comcast Newsmakers, I'm Michael Bybee.